So thank you so much for having us. So I'm Brandi Henson. I'm a psychologist in the Cardiac Neurodevelopmental Program, and Catherine Ullman Shade is our education director. So we're going to talk a little bit just about the general neurodevelopmental risks associated with congenital heart disease. Think a little bit about some of the things you might see in kids across the lifespan, and then talk a little bit about what our program offers and how we support children and families. And I think, Jill, you had asked us to kind of focus on maybe some of the newer initiatives. So we'll try to talk a little bit about some of the new things that we're doing. Let me see if I can. Okay. So I'm sure that most of you already know a lot of this, but we do know that congenital heart disease is the most common congenital abnormality. 8 to 10 live births in the United States are born with congenital heart disease, and 25% of these have more critical CHD. Whereas many years ago, the focus was on really kind of trying to fine tune the surgical procedures that would help with survival. Now we know that, 90% of kids with CHD live into adulthood, and there are currently 1 million children living with CHD in the United States. And what we also know is that while the focus on survival is no longer it's so essential because there have been many advances in the surgical techniques, we do know that a lot of our children face pretty significant neurodevelopmental challenges, both very early on and then throughout the lifespan, and as well as some different social emotional challenges. So we'll talk a little bit about that. So in 2012, several authors got together and reviewed a lot of the data that looked at neurodevelopmental outcomes in children with CHD, and found that even among those with mild CHD, about 25% of kids showed some sort of developmental delay at some point in their lifetime. And as you sort of move forward across and think about kids with more complex CHD, or those who have a comorbid genetic syndrome, the risk for developmental delay or increase. So the colors here, the white, those with no disabilities, the lighter gray show mild or mild disabilities. And then, sorry, there's a separate box over here that I don't know how to get off. I hope that's not in everybody's screen. Is that here, the start rehearsing? Do you know how to get rid of that? I've never seen that before. Okay, I'm just gonna have to just pretend like it's not there. Sorry about that. And so just the dark gray boxes here show those with severe impairment. And so you can see, there's definitely a reason for us to be thinking about how to best support kids with CHD. And so one of the questions that we get asked a lot is, what does my child's brain have to do with their heart? Why do we have to think about neurodevelopment in kids, even for those who have had really relatively simple procedures? We do see that there is some degree of risk. So interestingly, one of the neurologists that works in our program, Dr. Caitlin Rollins, recently did some work that looked at the brain volume of fetuses with congenital heart disease, and found that across the board, there were changes in the overall size of the brain, and then also changes in very specific areas of the brain that are associated with the white matter networks, which are associated with things like attention and executive function skills, which we'll talk a lot about. One of the interesting findings from her study was that the fetuses with congenital heart disease, the brains were more similar to those who had a relative with a family history of congenital heart disease than they were to other normal controls. And so what that indicates is that in addition to some of the surgical factors that may be related to neurodevelopment, which we'll talk about in a minute, it's also likely that there are some genetic factors that are influencing both heart development and brain development. And so I want to think a little bit about what are some of the different issues that impact neurodevelopment and psychosocial functioning in these kids. So early on, a lot of the research was focused on the medical and surgical factors. So particularly a lot of the early research looked at the method or the duration of bypass that was used, whether or not there was a need for CPR or ECMO, the specific drugs that were used during the surgical procedures, and whether or not, kids who had longer hospital stays. But now, our thinking about this has really expanded, and we know that there are lots of factors that are present both pre-surgery and as the child's life continues. And so, for example, we know that the severity of the heart defect has a significant impact on things like neurodevelopment. We know that if there are other genetic syndromes or genetic anomalies, that also is likely to have an impact. Things like prematurity or low birth weight can also add additional risk. And even after birth and after surgery, we know that things like socioeconomic status and education, those are also factors that can have a substantial impact on a child's development. And so we want to think a little bit about how neurodevelopment, sort of what it looks like in children with CHD across the lifespan. So very early on, I'm going to try to get rid of that. That's not working. Okay. Going to try to move that down there. Very early on in infants and toddlers, we see that there are often concerns about feeding and slow weight gain. Many of our babies have problems with sleep, and because often there are very specific schedules for medication and feeding, we know that very early on we see problems with the child's ability to self-regulate, to monitor their own internal cues about hunger or about needing, how they're feeling. And then as kids get a little bit older, we often start to see delays in some of the early language and motor milestones. As we get into toddler and preschoolers, it often becomes more apparent that kids have very specific speech and language delays. We may see that there are, young preschoolers have a hard time sort of grasping blocks or starting to use a crayon or a pencil to write or draw. Sometimes there can be gross motor challenges, so maybe having trouble with balance and coordination. At preschool, we start to see that there are often kids with more behavior problems. And again, this is very much tied to that early development of self-regulation. So one of the things we see pretty commonly is that kids don't have a good way to manage frustration. They often have a hard time sticking with something or working with things, or overcome by their emotions. And that can result in, sort of a tantrum or a meltdown. At the preschool age, and now as we think about kids kind of shifting and starting school, we often see a more pronounced separation anxiety. At school age, this is where we start to see more specific patterns that are kind of unique to kids with CHD. And so one of the most prominent findings are problems with attention and executive function skills. And I'm going to talk a little bit more about that in a little bit. So I'll hold off on talking too much there. We also see very specific concerns about spatial thinking skills. So problems with puzzles, building with blocks, really having a hard time sort of replicating what kids see. So taking something and then trying to make a copy of it. There can be concerns about drawing and writing skills. So this is partly due to problems just with their basic pencil grasp, but also again tied to the integration of what you see and the output. And then at this point, by school age, often we see that kids have caught up in terms of their basic vocabulary development, but there are concerns with being able to really organize a story, to kind of retell things in a sequential way. So often, parents will say, I don't know, he sort of talks all over the place. He talks in circles. He can never get to the point. And really, these are not so much about language, but about the organization of language, which really ties to some of those executive function skills that I'll talk about a little bit later. At school age, we do often see very specific learning challenges. As a whole, we often see that kids have a higher need for support in school. And then also we see specific concerns with reading or math, and Dr. Ullman Shade can talk a little bit more about that in a bit. And then we also start to see more clear patterns of anxiety and worry by this age. One of the things that we've started to hear a lot about in our program in the last year or so is a sense that emerges pretty early on of feeling different. And this can have a pretty significant impact on self-esteem. So for example, we've heard kids talk about how, when they were really young, they were the only child that was allowed to have a water bottle on their desk, or they were the only child that was, had to miss something like a particular activity in gym class. They couldn't quite keep up on the playground or again in gym class. And that starts pretty early on to sort of, impact the way they feel about themselves or the way that they see themselves. And so this is a big focus of our program right now. And more recently, there has been increasing evidence that some of these neurodevelopmental and psychosocial challenges continue into adulthood. And so as a whole, adults with CHD tend to report higher levels of anxiety and depression. And, they struggle sometimes with being able to manage kind of day-to-day skills. Their quality of life is a little bit lower. And this varies quite a lot based on, the study that's being evaluated. But a lot of the challenges really stem from the continued difficulties with attention and executive function skills. And then in some populations, we do see that there are secondary health complications that, after sort of a lifetime of having to struggle with managing their pediatric heart disease, now often there are new challenges that get added to that. So I do want to talk a little bit about executive function skills a little bit, just because this is one of the things that is, I think, probably the most common referral to our clinic for neuropsych evaluations, and also one of the more common things that's reported by teachers when we go in to do some of our Hearts in the Classroom. So we'll talk about that in a minute. So there are lots of different ways to think about executive function skills. Really, there are lots of analogies. Often people will use the analogy of being a conductor of an orchestra, or the CEO of a company, or an air traffic controller, right? So the idea is that this is the part of your brain that's really responsible for kind of controlling all the things coming in and managing, right? It's the multitasker. But so there are different things that have to be thought about. So, when we think about executive functions, there are some sort of basic executive control skills that are required. And these all work together to help with some of the higher order executive function skills. And so when we think about the more basic skills, first, inhibitory control refers to being able to regulate your attention and your behavior for the purpose of doing something else. So, when you're on a Zoom class, a Zoom talk, and you've got other things beeping at you, and you've got other people talking around, right? Being able to sort of focus your attention in and ignore all those other things that are coming at you. And this is something that a lot of our kids have a really hard time with. They tend to blurt things out or talk over people. They're really struggling with kind of keeping their attention where it needs to be. And then another part of executive control is the working memory. So this is really the ability to hold information in your mind and manipulate it in some way. And so this refers to being able to follow a set of instructions in the correct order, or be able to rehearse a phone number until you dial it, or to be able to listen when mom says it's time for you to go upstairs, brush your teeth, get your PJs on, and come back down so we can read a story, right? Being able to hold all of those pieces and follow through with them at the same time. And then one of the other parts that I think is really very common and that we hear a lot about is cognitive flexibility. So this is the ability to think in different ways, to sort of evaluate different perspectives, and to shift when something isn't working. And so all of these things, so we hear a lot about kids who are really rigid. They like things to be done in a very specific way. They are very routine based. They get frustrated when other people want to do things in a slightly different way. And so all of those sort of primary executive function skills need to be able to work together to carry out some of the higher order thinking skills that are needed for, problem solving. So things like coming up with a plan, organizing how you're going to approach something, prioritizing what's most important, and then, if we think about that flexibility, shifting or adapting when your strategy or solution isn't working. And so we see that there are aspects in all of these different areas that kids with CHD tend to have quite a bit of difficulty with. And these play a huge role in their classroom functioning, in their ability to be successful or independent in the home, and even in their social relationships, because often kids have a hard time sort of thinking about what somebody else is thinking about, or negotiating or compromising, because they're a little bit more rigid or inflexible. And so, I want to talk a little bit about how our program, the Cardiac Neurodevelopmental Program, helps. So our program has been around, initially was launched in 2008, and the focus at that time was doing inpatient consultations for babies who had just had surgery. And Dr. Butler is the primary psychologist who leads the inpatient evaluation and consultation service. And she still sees as many babies as she can when they're at the hospital. But over the years, we've really expanded quite a bit. And so in about 2010, they launched, it became really clear that we needed to follow these kids over time. And so we launched an early neurodevelopmental follow-up clinic that evaluated kids in a really strategic way at 18 months and then again at 3 years old. And as part of this, we developed a data registry to help kind of keep track of how kids were doing, so we could determine if there were specific areas of vulnerability. As the program has expanded, we realized that we couldn't just evaluate these kids as toddlers and preschoolers, but we needed to follow them through school age. And so we do a lot of neuropsychological assessments for kids, both those who've had their surgery at Children's and across the country and throughout the world. In 2014, we started to expand to really include other behavioral health services. So we have started doing more individual therapy, a lot of parent guidance work. And then we launched some other community programs like the Hearts in the Classroom program, which Dr. Ullman Shade will talk about. We started doing these days at the farm at a therapeutic horseback riding camp where we invited patients from our clinic. And as we've grown, we've continued to really launch some additional programs. So we now have a partnership with Harvard Law School where we work together on cases to try to get educational services for patients. We extended the day at the farm to a broader week-long horseback riding camp for kids. We launched a symposium for families where we kind of review all of the different neurodevelopmental challenges and figure out ways to support both children and families. And then we also launched the start of a prenatal program, which I'll talk a little bit more. And that's been over the last couple of years. And then the other thing that we recently started to do was to really focus not just on that prenatal period, but also on the kind of transition for kids as they move from adolescence to young adulthood. So this gives you a little bit of an overview of the different kinds of programs that we have in CHD, in CNP. So I want to talk a little bit about some of the kind of newer programs or initiatives that we have. So again, in the last couple of years, we've launched a prenatal program. Oops, I'm gonna back up for a minute. So the prenatal program is really focused on providing support and stress reduction strategies for those women who have been diagnosed with a fetus with CHD. So immediately after diagnosis, the parents are referred to the program. This is pretty varied and flexible. And so Dr. Catherine Clark is the psychologist that works with the newly diagnosed women. And sometimes she sees them for just 1 or 2 sessions, and sometimes she'll see them throughout the remainder of the pregnancy and then again after delivery. as I mentioned, a lot of what we do is assessment. And so we have outpatient assessments that start at as early as 1 year of age and continue on. We see patients through the age of 24. And the goal of the neuropsych assessment is to really help identify a child's strengths and weaknesses across all those different domains of development. Try to figure out why a child might be struggling, whether it's at home or socially with their peers. Or kind of is why kids are really struggling from a behavioral standpoint, and we determine what areas need support, and then try to identify strategies that would be helpful both in terms of school planning and working with families. So I wanted to turn it over to Dr. Ullman Shade for a minute to talk a little bit about the Hearts in the Classroom program, which she really leads. And hopefully there's not things that I missed on there. Oh, can you unmute her? Jill, could you unmute Catherine?
There we go. Okay, that was a really effective way to keep me quiet for that long. Usually in your presentation, I have like a little bit more to add.
I'm sorry. I had made Brandi host, and I didn't know how to.
Yeah.
Oh, I'm sorry.
I was
to try.
Yeah, no, it's okay. I know I texted you. Or I like chatted you a couple times, but no, everything's fine. And one of the things I chatted is if people want more information about any of the learning challenges that Dr. Henson referred to, I'm happy to elaborate on any of that. And I actually have if I could share a screen too, because I have a different thing pulled up that can go into more detail about some of those learning challenges. But yeah, so I think some of you are familiar with our Hearts in the Classroom program. We are blessed to have some really wonderful philanthropists supporting a lot of this work. So some of this we're able to provide free of charge to families, but basically we've realized that so many of the kids we work with are struggling in school, and there's often a disconnect between the care that they're getting at the hospital and the care that they're getting at school, and such that like the teachers often don't really know that much about their diagnosis or how it might affect their learning, and at the same time a lot of their physicians and nurses may not understand very much about how they're performing at school and what that's like. And we recognize how incredibly important the school time is for them. After a certain age, it's a huge percentage of children's time, right, is spent at school. And a lot of their self-concept has to do with how well they're doing at school, right? So that's inspired us to launch this Hearts in the Classroom program, which is a collection of services that help us to form a connection between the hospital and the school, and to facilitate that communication, those open lines of communication, and we hope allow children to do better, in all contexts. And you just took away the bullets, but that's okay. I know it.
So it happened.
I don't know, you unscreen shared. It's okay. So sort of I'd say the primary service is a professional development workshop that we're able to provide to a lot of our patients' schools, and that's able to be done free of charge, is supported by a philanthropist. So we can adapt it to the needs of individual kids and individual schools, but generally it'll mean that I or a different clinician, if more appropriate, will either go to the school virtually or in person and talk for usually about 2 hours about congenital heart disease. If parents want, we can talk about the particular child's diagnosis and how it can affect brain development and how it could affect learning. And then we spend the rest of the time really thinking about like, what is the learning profile of a lot of kids with congenital heart disease? What might that look like in the classroom? And then critically, how can teachers support these kids? Because we found that some of the learning challenges that kids with CHD often come with are a little hard for teachers to grasp. It's not as straightforward as like a reading disability. So it may be a little hard for them to imagine, for example, if a child has trouble with visual spatial skills. It can be really hard for a teacher to imagine, well, what's going to be hard for them in the classroom, and how can I adapt my teaching to sorry, I have kids home. I'm trying to make sure they don't interrupt. And how can I adapt my teaching to make sure that I can really meet their needs? So that's a big focus of these presentations. So that's one of our, that's what probably our primary service. We also—
I'm sorry, Kate, hold on. Can you hold on
Yeah.
1 second? So I'm sorry, Jill, can you make me the host again so I can put the slides back up?
I also could, yeah, share something else right now if that's better. All right, I'll just keep talking while we're working on it.
Okay.
There we go. Yeah, so then we also have limited opportunities to provide some other more intensive services for students who are particularly struggling, or we feel like the school is particularly struggling to meet the child's needs. So sometimes another clinician or I is able to do a school observation where we either, usually in person or occasionally virtually, will watch the child in the classroom and see how they're functioning and how they're learning, and that can help us provide, sort of much more detailed recommendations in terms of the way they should be taught. Also participation in school meetings, so things like IEP meetings or, other conversations with the teachers to help them really understand our findings and to kind of translate that into the classroom. Reviewing IEP documents or 504s. And all of these services are just, because they're purely educational, they're often going to be self-pay services if that's something that people are interested in, except in cases of economic need. And then finally, we have educational evaluations. So this can be both in the context of a team evaluation, where we do sort of an educational screener when you come in for your, sort of your standard neuropsychological evaluation. We can do a limited amount of academic testing in that setting. And then also for people who need more information about their child's learning, or who maybe are wondering if their child meets criteria for a specific learning disability, we can schedule full sort of 2-hour educational evaluations to get kind of much more in depth. And then also, it's not on here, but educational consultations are another possibility. So it's where it's like a 1-hour appointment to come and talk about whatever your educational question is, whether that's like reviewing an IEP, or is this school appropriate, or what kind of dyslexia does my child have. I think that's most of the services. Right, Brandi, is there anything I'm missing?
I think that sounds good. Yeah.
I think that's it. Yeah.
Okay. And I know people are popping questions into the chat, so we'll try to go through those at the end. I'll just kind of breeze through a couple of the other things. So, as I mentioned, we really have kind of expanded our behavioral health services over the last couple of years. So now, we do sort of 1 or 2 visit consultations around development. We do have some clinicians who see kids for ongoing individual therapy, or we do some parent guidance work around behavior management. And we do have some child and parent groups that have recently launched. And that's going to come up again in a minute, so I'm going to hold on to that. The other thing that we realized over the last couple of years is just, again, how important it is to continue to help children and families as they kind of continue through and advance into adolescence and young adulthood. And so about a year ago, we conducted some focus groups with some of our current patients and their parents to try to get a sense of what some of the needs were to support this process. And we heard a lot from families about feeling really unprepared and feeling like they needed help navigating. We often had parents say, like, I just need a roadmap that's going to help me figure out how to do this. And so we also heard, again, a lot, both from the patients themselves and from parents, about this, kind of difficulty finding your voice in telling your story. And we heard very different sides of that spectrum. So for some kids, we heard, like, I'm so tired of this being my identity. I don't want people to know this about me. I don't want everything to be about my cardiac history. And other kids said, like, I just don't know how to navigate this now that I'm an adult. Like, how do I tell people what's relevant, but not tell them everything that I've been through? And we over and over again heard both from kids and their parents that there was this real need for support and connection. And so some of the things that we have done, that in the last year, we've really launched a more transition focused program, and that's led by Elisa Bronfman, who's a psychologist who was formerly the head of the coping clinic at Children. And so the transition program has many different aspects to it. So on the one hand, we have more focused or tailored diagnostic assessments and consultations that really help to identify what the needs are, what kids want for, what they see as their goals for the future. And then we sort of identify what are the barriers that might be hard and what are the strengths that you have that would help you to attain those goals. And then we are launching some parent workshops, so webinar style workshops that will focus on different aspects of, things like exploring guardianship when that's relevant, or thinking about, evaluating, helping to find the right provider, transitioning from pediatric to adult care, understanding the educational services that schools offer. We have really thought about, this is not launched yet, but I think Kate could certainly talk to you about the plans for running the Adulting 101 workshop, which is really geared for, our teens and young adults, to try to help them figure out how to sort of navigate the world of independence. And we have really launched a number of different therapeutic groups over the last couple months. And then also a teen council. So I'm going to let Dr. Ullman Shade tell you about that in just one second. And then the other thing that we're really trying to do is work with the Boston Adult Congenital Heart Program, which is led by Michelle Gervitz, and try to figure out how to establish mentorship programs. Again, we heard over and over again, there's this need for connection and support. And so we want to try to connect our younger kids with either older adolescents or young adults who may have some experience in how to, again, navigate these conversations about, what your cardiac journey has been like. Kate, do you want to talk a little bit about the teen council and some of the groups? Oh, Jill, if you could unmute her. Or can I do that now if I'm the host? I got it.
All right, there we go. So this, I think this is, we are really very actively designing the elements of the transition program right now. So some of these categories are sort of shifting a little bit. But the things, that we have that are definitely currently up and running are the therapeutic groups. We have two is maybe end up being 3 soon for young people themselves. And then we have 2 active parent groups going on. And again, I think Dr. Henson mentioned the transition program is aimed for young people ages 12 to 24 and their families. And then at this point, a lot of the content that we were thinking of as sort of Adulting 101, we're actually putting into the therapeutic groups. So it's both about, we're working with young people with skills like, promoting their executive function, staying organized, self-regulating, controlling anxiety, but also things like, okay, what's a medical passport? Like, how do I make a doctor's appointment? So some of that more concrete things. And we are thinking about having sort of more dedicated workshops that function, that maybe are shorter term, that teach kids some of those like very concrete sort of adult skills. And some of those will be aiming towards young people who, may not be living fully independently as adults, or may require some support as adults. And others are going to be, and especially probably over the summer, aiming towards young people who are expecting to live independently and working more on skills like, how can you stay organized in college? How can you keep track of your own medication? That sort of thing for young people who are likely to be, having, eventually have a job and live on their own. The teen council is kind of been a moving target, but right now I think, so we're seeing that as we've been having, so we're gonna be having monthly meetings. We've had a few meetings with groups so far. One thing that's really nice about the teen council is, since that is a complementary program or not billing insurance, we can welcome young people from other states. Whereas for the therapeutic groups, people have to be residents of Massachusetts. So it's a really nice chance to get a wider range of our young people in. And we're focusing on doing projects that sort of give back to the community, because we've heard from so many teenagers how grateful they are for this, community of parents and providers who supported them their whole lives, and they want to sort of give back. So last year we had some teenagers who made this really remarkable video, and they did it like almost entirely on their own. The concepts is all on their own, kind of telling their stories and thanking, parents, and trying to give reassurance to parents that their children can have CHD and grow up and be okay. They may still have some challenges, but they'll be okay. This year, the teens are going to be working on a video that's what I wish people knew about CHD. And actually, it's Ava who gave us the idea for this, because she was so articulate in saying, like, people just should really know, and then like telling us all of these incredibly insightful things. So it gave us the idea. And Jill, I hope we can talk later, because I really am hoping Ava will be involved in this. That we want kids to make a video, and I'm hoping this may eventually turn into, maybe something printed too. Telling, clinicians, parents, other kids what we should know about CHD. So anyway, these are just some of the initiatives we have going right now. We're really very committed to getting our young people feeling really prepared for this next step as they start to enter adulthood, regardless of what their abilities are, regardless of whether they're going to live independently or not. We want to help them feel like they're going to enter adulthood feeling confident and living lives where they're integrated into the community and where they can give back in a way that feels fulfilling for them, whatever that is. And it's going to look really different from one young person to another. I'm happy to elaborate more. And also, if people have any ideas, this is still a program in formation. I'm scared to mute. I feel like I'm going to be muted forever if I mute. Here we go.
Oh, I guess I had another slide I forgot for the teen groups, but so I just have a slide up here for Q&A. I did want to just share a quick picture of our team, most of our team, so you kind of have a sense of who our faces are. And I'm going to just stop sharing so that we can sort of leave the last 20 minutes or so for questions. So a couple things that can probably I can answer quickly that I saw come up. So somebody asked about the webinars. So yeah, Dr. Ullman Shade mentioned this. The therapeutic groups are billed through insurance, and so unfortunately, right now we're limited to those people who live in Massachusetts, and that's because there are a lot of restrictions on licensure for out-of-state families. But some of the other programs, like the Teen Council, are free, and the webinars that we will do, those will be public and available to anyone. And in the past, when we've done them, we recorded them and kept them on Vimeo, I think. So if you missed it, you could kind of access the link. I think we kept them up for about a year. So let's see, same question as above. I'm terrible at going through these, so I don't know. Let me just take a minute to look through. Is there anybody that has a question that's not in the chat box right now? Oh, I guess, yeah, you'd have to put your camera on and maybe raise your hand with the little icon on the bottom if you wanted to. Okay, so I just clicked ask to unmute.
Hi, what are you doing?
Good, how are you?
I actually just put the question on the box, but I just wanted to add to that question, maybe like rephrase it. Is there like a different, I know that you guys have the programs, for heart kids and stuff. Is there a program that evaluates the kids for developmental? Like, I know Children's has their own list, but is it separate or is it the same team?
Yep, no, so we have a program that we follow kids with congenital heart disease, as well as kids with acquired heart disease, usually those who've had a transplant, who had a run on ECMO. And then occasionally we also see kids with genetic syndromes that often are associated with congenital heart disease, even if that's not their primary presentation. So we are a separate program. Our clinic just recently moved to Brookline Place, one of the new buildings. Like, it's about 2 blocks from the main hospital. So all of our clinicians now are doing their evaluations there, and we'll evaluate kids from age 1, really from age 1 up until age 24.
Okay, so if I get for example, my CHD child is in early intervention right now.
Yep.
So if I need a referral for that, do I contact you guys directly, or do I go through his pediatrician? How would that?
Yep. Yeah.
Just evaluation for speech.
Yep. Yeah. So you could definitely contact our clinic to try to set up, to get your child scheduled for an evaluation. I'll put up the contact person for our scheduler at the very end of the.
Yeah, I actually just direct messaged her Donna's contact information.
Okay.
Yeah.
Okay, perfect. Thank you so much.
Yeah, sure. This slide, somebody wanted to see the slides of the graphs. Was that something that you wanted to see now, or I'm happy to sort of convert the slideshow to a PDF and and then if Jill, if you could email that around, would that be helpful? Okay, great.
Okay, and just looking through some of the questions, because I know it's hard to talk and scan at the same time. Yeah. Somebody, Amanda asked, will there be a part of this program that follows our current patients into childbearing years for more prenatal and genetic testing for, presumably, women who are, who have CHD, so where their child might be at higher risk of CHD. Currently our program is following young people to age 24, which I suppose is technically childbearing, but probably a lot of people would not be choosing to have children yet. But we also work closely with BAC, which is the program that follows young adults or adults with congenital heart disease at the hospital, and eventually the cardiology care would transfer over to that program. And I know that they are very comfortable helping young women who are considering having children. Brandi, do you have anything to add to that?
No, I guess I saw that pop up, and I wasn't sure if there was something specific that you were wondering about the follow-up. Was it to identify women who are at risk of carrying a fetus with CHD, or just to sort of look at kind of the trajectories over time? I wasn't sure.
Oh, sorry, Amanda. Yeah.
Yeah, hold on.
Clarify your own question. Can we unmute Amanda? There we go.
I did. Sure. So what I was trying to find out is, because my CHD child hasn't had any genetic testing, to help her be informed as she gets older, should she, become pregnant or want to have kids, and try and navigate that, especially with her executive function disabilities that she has going on. So I know that they follow them up until 24, but even just giving the families maybe the data on how prevalent it is for it to be, what's the word I'm looking for, passed on through generations.
Yeah, so I think those are things that the Boston Adult Congenital Heart Disease Clinic, they have a lot of conversations with their young women about sort of what the risks are. And then for people who do have a specific question, we work really closely with Amy Roberts, who's a cardiovascular geneticist. I don't know what her age cutoff is. I think the hospital generally tries to stop seeing patients at 18, but very specialized programs will continue to see patients longer. So I can't answer exactly what her cutoff range is.
Also, and Dr. Henson, correct me if I'm wrong, I also would imagine that if you're wondering if your child has a genetic condition she's never been tested, and she does have these sorts of, anomalies, I imagine you could probably see Dr. Roberts anyway for genetic testing, and then she could give you a sense of if it's something that would be likely to be heritable.
So because as parents, we don't, I have a co-parent who doesn't consent to that. That limits Kristen's, base of information for herself, and I'm trying to figure that out anyways. But it complicates it. So I am hoping to be able to participate in some of the family programs that you all have.
Great.
Gotcha. Okay.
Thanks.
Yeah, and obviously
maybe-
when she reaches age 18, then she makes those choices, if that's something she's
Yeah,
interested in.
maybe they'll let her slide in.
And I'm just putting the number in the chat for everybody, because Kate, you said you just sent that to, you just private.
I
messaged
just sent
that,
it
right?
to, I hope I'm saying her name,
Oh,
Lisa Lee.
no, I did it
Like-
wrong. No, I did it wrong as well. Hold on
Okay.
a second.
Sorry if I mispronounced your name.
No, that's okay. So our wait list, I just saw that pop up. I'm just gonna try to, this is Donna Donati. She's the primary scheduler for our program. So if anybody is interested in, contacting her for an evaluation or for treatment, she would be the primary person. In terms of the wait list, it varies depending on the service. So I think for evaluations, it's probably about 5 to 6 months. That may vary depending on the age of the child. I think the wait list is a little bit shorter for younger kids.
Certainly better than a lot of other clinics at the hospital, even though it is kind of long.
For treatment, I think the wait list is fairly short. Usually, I think it's about a month or two before we're able to get people in. And if it's a short-term consultation, like, hey, I just have some questions about how to manage this particular aspect of development, then often we can see you for 1 or 2 visits. Most new patients to our program are seen for a psychodiagnostic interview. So that's about an hour and a half long. And we just sort of review all the different potential areas of concern and kind of explore sort of what the history has been like, to try to figure out what additional services might be helpful. And those, I think, usually get in within about a month.
I saw, so Anna Mary asked, and she said she hears this question a lot. How do you approach schools and ask or convince them to bring in the Hearts in the Classroom program if they only have one child with CHD in their school? So I think it's, it's a little bit of an art. Unfortunately, like, you have a right to have someone come into your IEP meetings, to have someone come and observe your child in the classroom, and a public school is not allowed to say no to those services. Even if they try, they're not legally allowed to. For a training, it's their right to say no if they don't want it. But that said, if you're having trouble, I'm happy to talk to them and see, and, try to convince them. Things I've found in the past that are helpful is we can try to do a really focused training with just the people that immediately work with this child. So it doesn't feel like it's taking time out from a lot of other people. I also I'm also happy to shorten the training. So like, if they can only do an hour, they can only do 45 minutes. I'll do what I can in the amount of time that I have. I've even done 20 minutes. Like, it's, it's better than nothing. And also it's helpful to point out that, like, yes, the very beginning of this presentation usually focuses on congenital heart disease, but the types of challenges that we talk about are very common with a lot of other populations of kids, and especially like kids born prematurely are, really have very, very similar profiles. So I've always had teachers say, oh, and this also connects to all of these other kids. So really a lot of their sort of less typical learners who've had kind of widespread sort of mild disruption in the brain from whatever cause, they tend to have a lot of the same challenges, and usually teachers find it very helpful. And they're usually making connections, not just to the one child, but to multiple children. So I hope some of that helps. And again, I'm happy to kind of work with individual teachers or school administrators to see if we can make it work out for them.
I saw that, Jill, you asked if you mentioned that many kids with CHD are diagnosed with ADHD, and wondering about medication treatments and also about whether or not that's a misdiagnosis. I think that's a really interesting question. So if you look at, studies that have evaluated kids with CHD, there is a much higher incidence of ADHD diagnosis, and that is true. It's increasingly true for kids with more complex heart disease, but true across the board as well. Many of our kids do have straightforward, if that's a thing, ADHD, but you're absolutely right that many of our kids, there is a much more complicated picture that does also involve more broadly other executive function skills, but also involves, often these visual spatial deficits that otherwise would not be part of ADHD, or, again, these language challenges that really are more a function of their executive control of language. So we do see these pretty complex profiles. In terms of treatment, many of our kids do benefit from medication. So in our program, there are some kids who are followed by their pediatrician, but most of our kids, their medication is managed by Dr. Rollins or Jocelyn Pedrick in neurology. And the reason we do that is because they work very closely with the medical team to make sure that, the medication choice is safe for that particular child, and their physiology. And then they can monitor a little bit more closely. I think somebody else just popped up stimulants. And so, yes, many of our kids are on stimulants, the same medications that would be used in the general population. Some of our kids, that is not safe or they're not effective. And in those cases, they do try other things. And so, again, as a psychologist, I try not to talk too much about specific medications, but certainly Dr. Rollins and Jocelyn Pedrick in neurology are great resources for that. And I think
the most important thing to know is that most kids can be safely treated if needed, right? And for many kids, the benefits far outweigh the risk.
I unfortunately don't have the name of the phone number for their scheduler right now, but we tell everybody just call Donna and she'll get it for you. But if you look them up on the hospital website, you can probably find them. But those are the two providers. So Jill, you were asking about resources or recommendations for kids' rights, like special education rights. Is that what you were asking about? Yeah, we often refer people to there's a really great overview of the special education process that's was put out by I think it's put out by the Center for Children now I can't think of what the acronym is. It's Mass Advocates for Children, I think. And then there's like another branch. I can't think of who it is. No, it's the Federation for Children with Special Needs. That's what it is.
I thought you were going for it, but then you started.
I could not get the right combination of words there.
Yeah.
So they have a really great downloadable overview of the special education process that I think is really comprehensive. It is specific to Massachusetts. So it does review the federal laws, but then it does talk specifically about some of the time frames which are more pertinent for people who live in Massachusetts.
That's also the type of thing that I can help people with if you have specific questions for your child.
And then I don't know, Jill, I can send you afterwards if you wanted to distribute. There is a really nice article that was written by Jane Newberger and Caitlin Rollins. So Jane Newberger is a cardiologist, Caitlin Rollins a neurologist. That's like a brief overview of the neurological and neurodevelopmental risks in kids with CHD. And often I think we find that it's really helpful to sort of give this 2-pager to schools, because I can't tell you how many meetings I've been in with schools where they say, well, I don't understand, her heart is fixed. So what's the problem? And so this kind of helps to sort of start that conversation about why you may see some ongoing challenges, even if the heart is fixed. Right. So I'll send you the link for that afterwards if you'd like.
So Nancy's asking a program for adults with congenital heart disease. So they had their surgeries at Children's, but were diagnosed as having autism as adults and looking for more supports. And she's in New Hampshire. So I think it probably depends a little bit how old adults they are. So again, if they're up to 24, they could come to our program. Otherwise, the BAC is the Boston Adult Congenital Heart Program, and Michelle Gerbitz runs that. But in terms of if you're looking specifically for sort of more neurodevelopmental support for the autism spectrum disorder rather than support for cardiology, I'm not sure if that's the best place to go. Brandi, do you have?
Yeah, I mean, I don't know, was the question looking for developmental support? So you can either answer in the chat or try to wave at me. Yes, developmental. Yeah, so we generally will, even for those who live in Massachusetts, we often, will refer families to whatever the Department of Developmental Services in the particular state, to try to make sure that the adults are adequately supported and know what the different resources are. In terms of evaluations, unfortunately, there isn't so there are lots of cardiac neurodevelopmental programs throughout the country and across and internationally as well. There aren't a whole lot of adult neurodevelopmental programs for those with congenital heart disease. So really it's looking for adult services in the general population.
So one provider who I know is very busy, but can sometimes see adults who have medical complexity and developmental concerns that we just spoke with last week, and she's confirmed she would be willing to accept patients, is Rachel Conrad, who works at the Brigham. But she has a very long wait list and definitely can't accept everyone, but she is an adult who does, neurodevelopment. I mean, she's obviously an adult. She does neurodevelopmental work with adults who have medical complexity and developmental disabilities. So
I think that might only be eligible to patients who are enrolled at the Brigham.
Oh, that's a good point. You may need to be a prior patient at the Brigham.
Yeah. So somebody asked about the link for the Harvard program to help with IEP. So that is something that is in collaboration with us. So this is a pretty new program and they only take one case per year. So if that's something you were interested in, you'd have to be enrolled in our program. So having started with one of those early intakes and then working with us, so that we really understand whether or not it's appropriate, because their capacity is pretty limited. There is a social worker, and I don't remember the person off the top of my head, but I can also send that. Let me just make a list of things, and I'll send them to Jill and she can distribute. I don't know, Kate, did you scroll through?
I think we got most of them. Hold on.
Okay. Yeah, so somebody just asked about early intervention and whether you could be enrolled in our program and in early intervention. Absolutely. So actually, we find that a lot of children are denied EI services, even though they should be able to access them. And so we find that it's really helpful to have an evaluation, in our program or somewhere else, so that you can really identify what the needs are and get kids enrolled in those services early on. And then, we really do try to support like the transition from early intervention into preschool. So it can be a really great time to have a more comprehensive evaluation than what EI can provide.
Okay, so I just scrolled through. I don't think we've missed anything. There is a sort of a conversation with a bunch of people just confirming that, like, yes, everything you said about executive function and attention, they are seeing. So I just want to kind of validate that like, yes, we're all seeing this and it's challenging. But I don't see any other questions that we didn't address.
Yeah, and so one thing that might just be helpful, I talked sort of broadly about a lot of the risks. It might be helpful just to kind of tell you a little bit about some of the things we get referrals for evaluation. So obviously, our program started as a follow-up clinic, right? So everybody who had surgery at Children's in the first year of life was supposed to be invited for evaluations at 18 and 36 months. And now it's really much more of a clinic referral. So the American Heart Association does recommend routine evaluations for kids with CHD throughout their lives. And so our program, I'd say the primary referrals are for attention and executive function skills. Sometimes those come in as questions about disorganization, problems multitasking, can't follow instructions, can't keep up with their workload. A lot of our kids sort of work at a much slower pace, and that can be hard for them to keep up, even if their core reasoning skills are intact. We also have sometimes kids, who have specific concerns about attention. They're distracted, they can't focus, they can't stay on task. We see some concerns about that more kind of emotional regulation, kids who get frustrated easily, who can't stick with something because they're overwhelmed by how they feel. We sometimes have kids who are referred for specific academic concerns like reading or math or spelling or writing. Writing is a big one because it takes so many of the other challenges and puts them all in one, right? So it requires you to stay focused. It requires you to use your fine motor skills, to use your language skills, to be organized, to come up with a plan. And so often writing is a real challenge. We also sometimes get kids who are referred because they're just not learning at the expected rate, or they're not making kind of developmental progress. And so there's concerns about more kind of global delays. We do see a fair number of kids who, have intellectual disabilities. So it's really quite broad in terms of the referrals that we get. And any of those, if you're seeing, you're certainly welcome to schedule an appointment with our program.
Jill asked if we have a form that lists the typical CHD issues that we can show to teachers and other providers who may think kids are being lazy. I don't think we have exactly this, but we should. I think that's a really, and I like Allie's reply.
We do.
I think it's a really great idea.
We have to find where it is.
I've often recommended that families share with their teachers. There's a scientific statement that was written a few years ago that really summarizes some of the main challenges associated with congenital heart disease. And it's fairly readable, but also, carries a lot of authority. So I find that that's often helpful to share with teachers, but it would be nice to have something shorter. Brandi, you're saying there is something like that?
Yeah, there's a great article by Caitlin and Jane. It's like 2 pages long.
Right. Okay.
But
yeah. We should have something though. You're right. I think it's
we developed it. I don't know where it is, but we do have a 1-page pamphlet, but I don't know what happened to it.
Yeah. Okay.
Yeah. So I realize that we're a few minutes over. So, I'm happy to stay on for a few more minutes if there are other questions, but otherwise just wanted to, say thank you to all for inviting us, and look forward to seeing you if you make an appointment in our clinic.
I'm stealing reclaim host back, I think.
Okay.
Okay. I think that's it. We touched, I think, everything that I wanted to discuss on this and more. This was awesome. Thank you guys so much. I appreciate it.
Of course.
Yes. And I can't wait to share this and post links, and this is great. Thanks.
Okay, good. Thank you so much, guys.
Thank you. All right, bye, guys.
Bye.